I'm Dr. Chan, Dean of Admissions here at the University of Utah School of Medicine. I'm excited today to talk to you about physician shadowing, a really important part of your application to medical school. First of all, what is it? So basically, if you want to become a doctor, you should really shadow a doctor to figure out if that's the life for you. When I went through undergrad, for the longest time, I thought I was going to be a lawyer. I took a bunch of political science classes. Back in high school, I was on the debate team. I loved arguing with my parents over curfew and things like that. One of my mentors, though, in my undergrad days said, oh, Ben, my first name is Ben, if you're interested in becoming a lawyer, you should really shadow a lawyer. So I did. I shadowed a couple of attorneys. They were pretty miserable. They really actively encouraged me not to become a lawyer, not to go to law school. Then the same mentor said, I hear you, even though you like to argue, that you like to help people. You should try shadowing a physician. I shadowed a couple doctors, loved it. Completely different experience. So today, in our medical school application process, it's pretty much expected that applicants will shadow a doc. And there's different reasons, different ways to look at it. So why is it important? Well, before you dedicate blood, sweat, tears, all these years to your life, you should figure out, is this the life for you? Because despite what you see on TV, despite those episodes of Scrubs where everything's funny, or on ER where it's like a thrill a minute, medicine can be very difficult. So our goal is, having applicants shadow docs, is to kind of figure out, number one, is this my path? And number two, what have you learned from this experience? You get a sense what it's like to work with patients. How does it feel as a doctor the first time a physician throws up in front of you? How do you feel as a potential doctor the first time a patient is dying and there's nothing you can do? All right. Something today that's becoming more ubiquitous is physicians are interacting with insurance companies. So when people ask me what's the worst part of my job, it's dealing with insurance companies. It's talking to these insurance companies on the phone, filling out all this paperwork, faxing stuff back and forth. You use a fax machine nowadays. So again, this is what the life looks like as a doc. It's not all blood, guts, and glory. There's a lot of tedium, a lot of paperwork you have to do. So what do we recommend? Minimum is 8 hours. You should at least shadow a doc for 8 hours. Average for us, we recommend at least 24 hours. When you're in the room, again, the way to kind of think about it is you should be dressed professionally, right? So you should, wearing something nice. The physician makes a joke, you laugh, the physician looks serious, you look serious. You're soaking it all in. You're learning through this process. By definition, physician shadowing is more of a passive process. Now, having said that, if there's something going on in the room and the physician needs help, you help serve the patient needs, all right? So this can be anything from, like this picture shows, helping holding down a child when they need to examine or listen to the heart or lungs, versus holding a patient's hand, maybe when they get their blood drawn or something like that, okay? Again, in our medical school, we recommend 8 hours minimum, 24 hours average, a healthy mix of primary care and specialists. So primary care being defined as family practitioners, pediatricians, internal medicine docs. Specialists are like surgeons, dermatologists, cardiologists. It was great talking to you about physician shadowing. I hope you have a great many adventures out there. I look forward to seeing your applications. Thank you.